Welcome back, everybody. Workers across the nation are in the thick of changing, renewing, or signing up for certain health care plans under the current open enrollment period. Millions of people could and actually very likely will see their insurance premiums rise pretty sharply next year. Joining us right now with insights on the current state of the health insurance industry is Mark Bertolini. He is the CEO of Oscar Health. He's also the new chairman of Verizon and the former chairman and CEO of Aetna, a longtime friend of the show. Mark, thank you for joining us.
Great to be here, Becky. Thanks for inviting me.
We spoke earlier this year when you came in about the problems in the healthcare industry. Nothing changed, nothing happened, but here we are, and we're probably at a moment where it's going to be getting a lot more attention because of what just happened with the government shutdown.
Yes.
There's a lot of confusion out there about premiums going up and how much of that is related to the subsidies ending, how much of that is related to a broken healthcare system that sees inflation far outpace inflation in other arenas.
So what's happening currently in the Affordable Care Act and the enhanced subsidies is that there's a lot of rhetoric about who's getting access to these funds, like $1.5 trillion being spent on illegal immigrants. Not true. 50% of American small businesses use the Affordable Care Act. Small businesses are 50% of our GDP. They're the engine of our economy. 27% of farmers use the Affordable Care Act, and the average farmer makes $60,000 a year gross. Their current premium is $75. With enhanced subsidies, it's going to go up to $300. So $225 a month more out of $60,000 gross is going to pretty much make it difficult for them to do other things like put food on the table, buy seed, do all those other sorts of things that operate their farms. So we're talking about the very basis of our economy and the people that make our economy work. 75% of the people in the ACA today are from red states. 100 million Americans don't have access to employer-sponsored health insurance in this country. And so with all of those characteristics coming together and the high cost of healthcare, drug development, skyrocketing healthcare costs in facilities everywhere else, we have a system built 80 years ago that has built into it inflation. Everybody they're not price sensitive to their benefits for the most part. And we built hospitals in every nation in the country, or every city and state in the country, so that we created a demand pull into the system that has driven cost up inexorably. Now, what the Affordable Care Act has done that most people don't understand is it's reduced uninsured from 15% to 8%. That has saved $10 billion a year in uncompensated care and charity costs that used to go to hospitals. $10 billion a year. That will reverse to an $80 billion problem over the next 10 years if we start moving that uninsured rate back up.
The answer isn't simply subsidies, though.
No.
There are so many broken things in the system and so many reasons that healthcare costs go up annually with or without the subsidies.
Exactly.
So how do you get at that, and what kind of problem solving can we actually do in the next, 2 months?
So we should create a qualified account, and there has been some concern about fraud, waste, and abuse in the system. There has been some, not as much as people would put on the table. 2.4 million was the number last year. People that are cheating the system. It was really 450,000. At Oscar, is 27,000 people out of 2.1 million people that we cover, so it was 1.3% when we got down to the actual understanding of each of those people. But let's create a qualified account that is the basis, the doorway to employers, government, or individuals putting money into a qualified account that allows them to spend healthcare their way. So if we put consumers in charge of buying the product, you're going to have an impact on price. Every time consumers get control of what they purchase, they have an effect on the underlying costs and the price of the services they buy.
When you say an HSA account like that, an account where money goes in, I think of a defined benefit going to defined payouts on what you can see with some of these things, much like we did when we got rid of pensions in favor of 401ks. It puts a lot more of the freedom in the hands of the individual buyer, but it also puts a lot more of the potential burden if you mess it up, that there's no safety net there to catch you.
Currently, 95% of people that buy in the individual market today use a broker who have the tools to help them understand which plans they should pick. So I think the first order of business is, do we have the technology and the support to be able to help people pick the right plan? Have money left over after they pick their plan? And turn around and be able to pay their out-of-pocket costs.
Is replacing Obamacare or in addition to Obamacare? Would you use?
I would redo the whole thing. I would use the individual market as a single risk pool. I would use the risk adjustment that's used to allay all the critical costs or catastrophic costs that go through the system. Get spread over many more people than it can happen to any one employer.
This is the Republican holy grail, what they want to try to do. It sounded like you started with making an impassioned plea for Obamacare, but you'd really like to do what Republicans would like to replace it with.
We would like to allow people to get subsidies where they need it. The farmer, the small business owner. And that's
but couldn't they get subsidies and then buy the HSAs?
Yes. Well, no, you put the subsidies into the HSAs.
Right.
You put the employer money from your employer into an
Into
HSA.
the HSA, right.
Right? And you could put your own money into an HSA.
And then then when you own it, you're not going to be, well, you don't care about what anything costs. You're going to watch very closely what everything costs.
That's exactly right. And 40% of Americans last year, 2 out of 5 Americans, borrowed $74.9 billion from banks to pay their out-of-pocket costs for healthcare. It's a giant suck on the economy. And so if we allow people to buy the network they want, because in the individual market we have narrow networks, I can find my network instead of my employer deciding what it is. I can buy my benefits. If I'm going to have a family, I want better obstetrics.
Right.
If I'm going to have surgery, I buy my benefits using the funds that are in my account, leaving me money to either pay my out-of-pocket costs, depending on the plan design I pick, or to buy other products like dental, vision.
But Mark, Obamacare is a sacred cow. You're never getting rid of it at this point.
All we have to do is evolve it. I don't care what you call it. Just use the concept of the network, of the risk pool.
But this is what Republicans have been saying, and people just roll their eyes that that's what they want to do.
Well, nobody's actually put a real plan on the table.
But they say HSA, find your own health, get the middlemen out, get the insurance companies out.
Well, no, the insurance companies have to be there.
They have to
buy
be
the
there,
policies
but they.
from.
By the way, you guys are working with people on both sides of the aisle
We are.
to try and bring this about. And I have to say, there are times when I think it is just an expansion of Obamacare. There are times when I think it is an evolution to the HSA program that the Republicans are pushing. But what you're really looking for is every American to be covered. And that's almost universal health care, but with the choice in the hands of the consumer on which one to pick.
But what I'm trying to figure out is where the margin's going to get taken from.
Yeah.
Somebody has to lose in all of this.
So what will happen, just like in automobile sales and in books and in other things people buy online, is that they're going to compress the margins by buying what is valuable to them. They're going to make that value equation.
Right, I understand that, but you're effectively arguing that more competition should compete away margin.
Yes.
But I'm trying to understand where the margin gets competed away most, meaning is it ultimately that actually it's going to come out of the hide of the doctors, it's going to come out of the hide of the hospital systems, it's going to come out of the hide of the insurance companies. It can't just be that that more money comes into the system and the same amount of profits
Unless
exist.
consumers are paying more.
And it's not all margin. It's actually inefficiency, gross inefficiency in the system. I mean, if you look at the hospital systems across the country, most of the country, they're most of them losing money.
It could be somebody's profit in some way.
It could be, right? But you have.
I'm not discounting what you're suggesting. I'm just trying to understand.
We've tried.
If we looked at a pie chart of where all the money is.
We've tried everything else to solve this problem, other than put the consumer in charge of what they buy.
Let me ask you one more question that always kind of worries me. I understand the concept of putting it into millions and millions of people so you offset the risk. But if every consumer who is healthy and young opts for the minimum, very bare minimum plan, as I would have done in my 20s, doesn't that just mean that the bigger pool is a pool full of far more expensive people who are therefore going to have to pay much higher premiums? If you're not offsetting the older, but if you're not offsetting the older people who need more help or the families with young, really healthy people, how?
But what happens in the market today is it's one big risk pool that gets settled at the end of the year across all the plans. So if a plan has more risk in it, sicker people, they get paid by the plans who don't have any. And so if you even out that risk every year, you socialize the risk across the whole population, you now don't have a problem of underwriting, which is what you're talking about. sicker people cost more money. Today in a small group, a pregnancy causes a double-digit rate increase the next year. One employee.
For one employee in a population, employee population of how big?
50.
So
Causes a
everybody has to pay
double-digit rate
more the
increase.
next year.
Right. So because you're underwriting that population and it's getting priced. In Michigan, double-digit rate increases for the last 5 years. In Arizona, 28 to 30% rate increases in small businesses today because they're underwriting that pool. And
that
so,
has nothing to do with the ACA subsidies, the additional
No, it doesn't.
subsidies.
And what happens with small employers is they stop offering coverage and they're sending them into the ACA, saying go buy your own product.
That's not good. But all the margins you're talking about, Andrew, every single entity that's going to see that happen is going to resist what you're trying to do.
Of course.
Well, and that's why I'm trying to understand how this is all going to happen.
It's not going to happen.
You have to give it to the consumers first. You have to create it, and that creates that creates the movement.
But there's a lot of hands in there.
There's a lot of hands in there. They're taking
getting
lots of pieces.
Yeah.
I mean, that's why it's been such an intractable problem for
Right,
so long.
right. But we haven't tried this yet.
What's
We've tried everything else.
What's the feedback you get from members of Congress when you lobby on either side of the aisle on this?
The way I've been talking about it is, so when Obamacare got started, people thought we're going to ultimately have an individual market for all Americans run by the government. That was sort of the aim, right? You can keep your plan.
Right.
In this model, I'm talking about you keep your network, you keep your plan. Your funding just changes. You separate the funding from the financing from the investment decision.
I mean, employers will love hearing this.
Yeah.
The defined
do like it.
contribution, they would love hearing it. But again, anything the employer is super excited about makes me think as an employee,
Well, we believe we can save up to 26% on the total cost of an employer group if we do it this way. So if you think about that as the model, ultimately the consumers are going to push it. They're going to push it through. So managing the risk across the whole population is really important. Number one. Number two, having innovation in product. And what happens with employers is they offer 2 or 3 products on one network. I don't get that choice. In the Affordable Care Act, we've limited the number of products we offer because the CMS was concerned about confusing people and buying their product. People are smarter than we think.
Yeah.
And they go to sources to get them. So this is the way to start the process.
It's an intriguing argument. It's an intriguing potential possibility. I've loved talking to you about this over the years, and I hope we get to do a lot more.
Mark, there's an entire political class that viewed the Affordable Care Act as baby steps to single payer.
Right.
They're not going to let you do this.
This would be single
single
payer.
It is in a different way. It's a free market single. It's not a government single payer. It's a free market single payer.
Right.
That would work. Well, that's the opposite of what they want.
Wouldn't it be great if we came to a single, quote unquote, single payer market, either through consumers aggregating their accounts through a qualified account or the government doing it, and all of a sudden this issue is not an issue between Democrats and Republicans anymore?
It's kind of brilliant. I mean,
wouldn't that be the best solution?
It appeal to everybody, but at the same time, it probably ticks them all off in some way too. Which
everybody's going to have an axe to grind. Everybody's going to hurt, but that's the only way we solve this problem. If we expect everybody to keep going as they're going and have this work, it won't.
Someone's writing in, Mark wants even more government involvement in healthcare. Is that how it would end up in your view? It would be less, wouldn't it?
Less.
The government's still got to fund a lot of it.
But
Medicaid, if you can keep prices down, it wouldn't be as much of a.
So in the Affordable Care Act, $7,500 a year for coverage.
Yeah.
In Medicaid, $8,500 a year in coverage, and I'm rounding it to the nearest $100. In employer-sponsored insurance, $9,400. In Medicaid, Medicare, $14,700.
Right. They don't do it very well, do they?
No, and so if you put all of that into a single pool where people can buy what they need, we're going to have a limit on the bottom where people have to have a qualified health plan, right? Something that is sufficient.
For catastrophic.
We can't have them just doing, these minimum benefit plans that, blow up after you hit a certain number.
Right.
So we have to have a qualified benefit, but we define that at the state level.
Yeah.
We can create these pools at the state level with state-based exchanges where people can buy. Then we can give people the freedom to buy what they want. And by the way, this is a red state kind of issue too, a big red state kind of issue.
Because they have so many people.
Yeah, in the program.
Okay, we have to run, but before we let you go, you are the newly named independent chairman at Verizon for the newly named CEO, Dan Schulman.
Yes.
Why the change and what's going to be different at this point?
Verizon has gone from #1 in market cap, bond ratings, and share to #3. And the network isn't as differentiated as it used to be, in large part because everybody's been spending money to put these 5G networks in place. So losing 30% share over the last 8 years is an issue. And we have to do something different.
What does that mean?
We have to evaluate underlying cost structure, all those sorts of things. And Dan's working on this, so I'm not going to get in front of Dan's story.
Okay.
But Dan is working on this every day. And we believe that once we have that plan in place, we'll have a good story. The street reacted early on that there's going to be a price war. I think it's less about price war and the value of what we're offering to people through the product. But Dan's coming up with that plan, so I don't want to step on his parade. And he'll be coming forward with it sooner rather than later. And I think, the board needed to act, and we acted.
Mark Bertolini, thank you very much for joining us
Thank
today.
you.
We
Great to be
appreciate
with
it.
you.
Thank you.
You too.